The overall goal of this diagnostic study is to define a standardized, evidence-based examination procedure to assess ankle dorsiflexion with the knee extended and flexed.
As there is no standardized test to assess ankle dorsiflexion, this examination method can help to define physiological and pathological values of ankle dorsiflexion. Clinicians will then be able to identify patients with impaired ankle dorsiflexion, which is the root of various pathologies to the foot and ankle. The main advantage of this technique is that it is a standardized, evidence-based diagnostic approach.
We first had the idea of this study when reviewing literature on impaired ankle dorsiflexion. Many of the existing examination protocols vary significantly. Therefore, we aim to define a more standardized test to assess impaired ankle dorsiflexion.
The visual demonstration of this examination technique is very beneficial, as it shows all of the key elements of this procedure in great detail.
Mrs. Alina Sint is a member of our foot and ankle research group and will help us to present the examination procedure.
Begin by asking the subject to remove footwear and any clothing covering the legs. Have two investigators perform the measurement, one conducting the test and the other measuring the degree of ankle dorsiflexion. Place the subject in a supine position on the examination couch. Mark the axis of the fibula by drawing a line connecting the center of the disc.